I would like to speak to you today about tissue and organ donation in the United States. There is a great need for tissue and organ donation. I'm going to tell you a little bit about a girl named Daisy. When she was born with a heart defect. Throughout her childhood, she had multiple aneurysms. At the age of 17, she was admitted for open heart surgery. The surgery was successful. Unfortunately, an undetected brain aneurysm caused her to go brain dead. She was an organ donor, and her parents decided to donate her organs to maybe give them some consolation and peace about her death. This gives them peace and brings them hope, and they are now advocates for organ donation for the hospital. According to the U.S. government information, organ donation and transplantation, as of September 2019, 109,000 men, women, and children were on the national transplant waiting list. 17 people die each day waiting for a transplant. 39,718 transplants were actually performed in 2019. Imagine one of your family members desperately needing a transplant and having to wait on this list, not knowing if they were going to see the next day. Now that I've told you about Daisy and how in her death she was able to save lives, I would also like to talk to you about the great need for people to register to donate and how many lives can be saved through this. It's very important to become an organ donor today. Although about 90% of Americans approve of organ donation, only about 60% of them are actually signed up to donate and registered. There's a lot of people on the waiting list that run out of time, and they never get a second chance at life. Every 9 minutes, a new person is added to the transplant list. Did you know that one person can donate up to 8 organs? That's 2 lungs, 2 kidneys, a liver, a pancreas, intestines, heart. I think I got them all. But it's pretty amazing. You can also donate your eyes, and you can donate tissue, like for bone marrow and stuff like that. So it's pretty amazing what doctors can do nowadays. So according to the Mayo Clinic, by becoming an organ donor, you can save and improve up to 75 people's lives. That's pretty amazing. Family members say this really helps in coping with loss. And, it's reassuring to know that your loved one, even though they passed and you're mourning their loss, that you can actually know that they really helped to save and improve lives. It is estimated also that about 20 patients die daily because of the lack of donor organs. That's a lot. Organ tissue donation can be difficult to think about. I mean, it is a tough subject to think about death and what happens to us when we die, what happens to our bodies. But it's such a generous and worthwhile donation, and it has such a huge impact on other people's lives. Now that I've given you some of the statistics and the obvious need for organ donation, I would like to answer some questions you might have about some myths or concerns that are surrounding it. The first myth that I hear a lot is, I'm not in the best health. They're not going to accept my organs or tissue. Well, it's amazing what they can do with transplants nowadays. And very few medical conditions disqualify you. And even, you want to let the medical professionals make that decision, because there's some organs they might be able to use, and then other organs that they can't use, but who are you to make that decision, you know? That leave it to the experts. Another myth that I see is organ donation is against my religion. Well, actually, there's no major religious organization that objects to organ donation. They often encourage it, and they see it as an act of love and spiritual generosity, and it's actually a very generous and loving thing. And last myth I hear is if I agree to donate my organs, the hospital staff will not work as hard to save my life. Well, first of all, there's two different groups of doctors and nurses. The ones that are working on saving your life in the emergency room, and then the organ procurement and all of that. And they're two separate teams. So the doctors that are working on saving your life have nothing to do with organ procurement and organ donation. They are going to do everything they can in the emergency room to save your life. It is only afterwards, when you're pronounced dead or, brain dead, that is when they come in. But they are totally separate entities. So now that I've shared some statistics with you and the importance of being a donor, I've also debunked some of the myths associated with organ donation. I would like to leave you with a story about a young boy, pretty amazing boy. I would call him a hero. But he was in a fatal automobile accident when he was 22 years old. His name is Cameron, and he was a donor, and he was able to donate his liver to a mother of 5 who had fatty liver disease because she had gotten that from her 5th pregnancy. He was able to donate a kidney to a lady who had been on dialysis for years, and it helped save her life. And then he also was able to donate his heart to a man that had been on the waiting list for 11 months for a heart transplant, so it saved his life. And then also he was able to donate a lot of his tissues and his eyes to other people to help improve their lives. And his mother also said that, she's an advocate now, and she talks a lot about it and about how Cameron really made an impact on people. And she said, there was some positive in all the negative. There was some good that came out of all that, even though it was devastating to her. But, his life lives on in other people and the lives he touched. So I would really, if you're interested in donating, and you can go to www.donatelifesc.org, and it really only takes like 5 minutes. I've done it. All you do is enter your information in your driver's license, and then you're a donor. And if, it's pretty easy, pretty simple, and please donate today. We need your help. We need everybody's help.